The story of HIV in Uganda is well documented, with the first case reported in 1982. With the height of the scourge in the 1990s, Uganda was hailed internationally as a success story in the fight against HIV. It took the concerted efforts of Government of Uganda, development partners, and indeed organizations like Makerere University Joint AIDS Program, commonly known as MJAP, to scale down HIV prevalence from about 15% in the 1990s to the present 7.3%.
We started MJAP, the Makerere Joint AIDS Program, nearly 10 years ago. And the reason for starting it was that, of course, the HIV epidemic was rampant in this country. A lot had been done, but a lot more needed to be done. Universities and teaching hospitals, we thought that they were not playing an adequate role in the fight against HIV. So we decided that Makerere itself as an academic institution would team up with another university, that is Makerere University, together with their teaching hospitals, Mulago Hospital and Mbarara Hospital, to come together and form a formidable force that will contribute to the fight of the epidemic.
We were established in 2004 with the funding from the U.S. Presidential Emergency Plan for AIDS Relief, PEPFAR, and technical assistance from the U.S. Centers for Disease Control and Prevention, CDC. We've therefore been in existence for close to 13 years now, and the particular project we are closing has been running for the last 6 years.
In 2010, Makerere University School of Medicine, with MJAP as the implementing mechanism, was competitively awarded a 6-year grant to scale up comprehensive HIV/AIDS services in the hospitals of Mbarara, Mulago, Butabika, and Makerere University, as well as health centers in Mbarara district. Working as part of a wider HIV response framework in Uganda, MJAP has from time to time realigned its programming to the global and country strategies, including the current UNAIDS 90-90-90 goals.
We've committed to the UNAIDS 90-90-90, meaning that we'd like to see 90% of the people living with HIV testing and knowing their status, and 90% of those who have tested and have turned HIV positive enrolling on treatment, and 90% of those who enroll on treatment achieving viral suppression, meaning that they are able to have their viral load as low as possible to minimize transmission to other people.
Identifying HIV positive persons and linking them to care is the first and critical step in HIV prevention.
MJAP was providing the provider-initiated testing and counseling, which ended up generating a number of patients who were HIV infected. As a result, we had to set up clinics to look after those patients.
Through innovative and creative campaigns, MJAP has provided HIV testing to more than 4 million people, with 457,647 HIV-positive patients linked to care. By the end of March 2017, about 50,000 patients, including over 1,900 children, adolescents, and young adults, were receiving HIV care from MJAP-supported facilities. 98% of these were on antiretroviral therapy. 87% of those on antiretroviral therapy had accessed a viral load test with viral suppression rate of 92%. Transmission of HIV from an HIV-positive mother to her infant has been one of the leading causes of HIV transmission in Uganda. In 2008, statistics showed that about 76 babies were born with HIV every day. MJAP supported the provision of comprehensive PMTCT services in supported facilities. Margaret and Matthew, are a couple that received PMTCT services in Mbarara Regional Hospital. After they got married, they, like any other couple, had dreams of starting a family. However, both were found to have HIV, and Margaret's dream of becoming a mother seemed to be shattered. When they visited the hospital, the doctors told them that in spite of their HIV status, it was possible for them to get HIV-free children.
Twaganira n'omushaho yatusobora yajja ntwasa kuzara abana batine kakoko twagirenda nazara omwana w'okubanza twamuha amatine kakoko ka siriimu yabe yahise emyaka 7 twayongeraho ndiijo nawe twamuha muje atine kakoko ka siriimu.
Ensuring that no child is born with HIV is a crucial step towards achieving an AIDS-free generation. With elimination of mother-to-child transmission services, many HIV-positive women like Margaret are now able to give birth to HIV-free babies. The number of babies born with HIV in Uganda daily significantly reduced from 76 in 2008 to 9 babies in 2015. Margaret has been one of the 40 HIV-positive peer mothers working with MJAP in Mbarara. Alongside her colleagues, she has given hope to HIV-positive mothers through counseling and sharing her experience. Over 280,000 pregnant women have been tested for HIV, and 28,000 pregnant and lactating mothers started on antiretroviral therapy with an early infant transmission rate of 2.1%. MJAP has worked to encourage male involvement in PMTCT services. 30-year-old Paul Kasaga is a male champion volunteer with Makerere University John Hopkins Care Limited, a partner of MJAP who has supported his wife during all her pregnancies.
Ono mchara wange yali rubuto neba mwebaluwa neba ngempita emulago bwena genda emulago bagenda tukebera akawuka ka HIV tukemulago tukebera akawuka ka HIV mu time eyo results zagenda okufuluma nga nze ndi positive ate omukyala ali negative era nakati mukyala wange ali negative talina kawuka nakati essaawa yaleero buno ayirupoto essaawa natulinda tugenda kufuna bibbi omulala.
To address the challenges of stigma and discrimination, it is a deliberate effort of MJAP to engage and involve people living with HIV at different levels of HIV programming. This encourages adherence to treatment and disclosure, and also ensures their voices are heard.
My name is Dr. Stephen Watiti. I'm a board member on the Makerere Joint AIDS Program, MJAP, representing people living with HIV. I think the importance of involving especially people living with HIV in AIDS care has helped improve the work that MJAP does, because the saying is that nothing should be done for people living with HIV without involving them. So putting a person living with HIV on at the top, meaning the management, I think it's good practice from MJAP, and they recognize that really as much as we work with people living with HIV, we also need to involve them. It has improved services because we're bringing voices of the people who are the consumers of the services, and this helps MJAP keep continuously improve the care of the quality of care that they give.
MJAP also uses peer educators like Sunday Asaf to share experiences, health information, and offering peer-to-peer support.
Isomo rinkwenda mutwegeho na ekwaterine nemera nungi eyembazi eyituruho.
The peer-to-peer model has also fostered adolescent-friendly services at MJAP-supported facilities. Adolescent forums are regularly held to help young people combat stigma and support adherence to treatment. 24-year-old Kiza Lubega faced stigma and discrimination because he was born with HIV until he joined a peer support group. Now a fresh graduate of a degree of pharmacy, Lubega is one of the dozens of peer educators who have dedicated their lives to inspiring a positive attitude among young people living with HIV.
I was born with HIV, you know that. And now I'm a pharmacist.
Many HIV-positive youth, like 18-year-old Semakula Dan, have benefited from this peer support.
I was born with HIV, and then I had self-stigma. I thought I was going to die. I thought that I'm not going to get education, but after joining ISS Clinic Lago, through counseling and guidance, I started gaining self-confidence. I started schooling. I'm now a candidate. I'm in Form 6. I've also gained skills like playing football, making black books, candles, so that I can get pocket money.
While working with the Most at Risk Populations Initiative, MJAP is proud to have established the first ever one-stop clinic providing dedicated HIV services for key populations. MJAP has also worked with community-based organizations to carry out targeted outreaches to people at a higher risk of contracting HIV. Another priority focus area for MJAP has been reaching men who traditionally do not embrace health services as enthusiastically as women. Over 60,000 men have been circumcised under voluntary medical male circumcision. Circumcision is offered as part of a combination of prevention interventions that include management of sexually transmitted infections, promotion of condom use, abstinence, and mutual faithfulness. In partnership with the Ministry of Gender, Labour and Social Development, Uganda Police, and different civil society organizations, MJAP integrated services for survivors of sexual and gender-based violence in supported facilities.
We really appreciate the effort that MJAP did on police. MJAP trained police officers on the training manual on SGBV, and actually we even received the certificates and the training manual itself. We appreciate for that. We've been together with the MJAP, especially on sensitization of the public, and also making referrals to MJAP, especially at Mulago Hospital, Butabika Hospital, and Makerere Hospital.
Interventions have addressed the physical and emotional consequences of abuse through counseling, provision of emergency contraceptives, and post-exposure prophylaxis. Achieving sustainability and ultimately epidemic control requires collaboration of various partners. MJAP works within the policies and guidelines of the Ministry of Health to strengthen health systems using a district-led approach.
MJAP has done a lot of work in the district. It has been a real district-led program implementing on ground and meeting the needs of the district. We thank them for supporting the system, the health system, and for in-service delivery. They have been able to accredit all our health center 4s and the 3s, and even health center 2s, 5 of them, which does not happen in other districts. We are so grateful for MJAP for supporting in capacity building. The district health team, the health workers are all equipped to deliver the service. And we cannot forget the infrastructure. They have really supported to renovate our buildings, give us furniture, give us computers. A lot of work has been done. Some facilities have been connected to the power grid, and the water extended like to the rubber suits in some facilities.
MJAP has embraced World Health Organization's health systems strengthening framework across all supported facilities.
When we got this project, we were under the PEPFAR 2 dispensation, and the strategic approach was strengthening health systems for them to be able to manage the HIV services as opposed to doing direct service delivery, and that has been our approach.
The people in the health systems, we've trained them, we've worked with them so that they get the capacity. And because they are the people who are working in those health systems and they are likely to stay, that contributes to sustaining the efforts of the country.
Addressing TB-HIV co-infection has also been at the center of MJAP's work. Indeed, MJAP pioneered the integrated TB-HIV services model that was subsequently adopted as policy by the Ministry of Health. This model has helped to bring TB and HIV services together, making it easier for people like Mpima to get all the care they need under one roof.
Bandeeta wano naye nga ekinuma sikimanyi. Kati bwe bantuusa wano abasawo ba wano ne bankebera ne bakizuula nti nina TB. Ne bantandisa eddagala lyabwe erya TB. Naye ate era nga ngattako n'eryakawuka nga bazudde nti nina n'akawuka.
Good nutrition is important in HIV care and treatment because it helps to keep the immune system stronger to fight opportunistic infections. MJAP supported integration of nutritional assessment, counseling, and rehabilitation activities, whereby underweight and malnourished patients were provided with ready-to-use foods. The HIV epidemic in Uganda has left thousands of children orphaned and vulnerable. To break their cycle of risk and poverty, they were provided with non-formal education that included livelihood, skills development, training in income-generating activities, and financial literacy.
With MJAP, I was able to study salon and hairdressing. So with that salon and hairdressing, that's where I got the skills of hair cutting. That's you have plating, you have massage, facial, pedicure and manicure. There are so many things I learned from salon with the help of MJAP.
They were placed as apprentices with local artisans for hands-on training.
Tata waffe yatulekawo nga tuli bato. Nali nina emyaka 4 we yatulekerawo. Bwe yatulekaawo, mama waffe n'atandika okutuweerera. Ssente ne zituusa obudde ne ziggwawo. Nga tetulina wakujja ssente ffe ne tutuula. Sina kye nali nsobola okwekolera nze ng'omuwala. Kuba nali sina kinjize. MJAP yanyamba nensasulira fees ku saluni n'enjiga. Bwe namala okuyiga byebyo ebintu bye nnina kati nange neeyagala ng'omuwala. Nsobola okutandika bizinensi eyange n'enjibeezaawo. Kuba nayiga okusevinga essente, manyi okubala ebitabo, manyi bizinensi nga wansobola ogirwaninga nga omuntu ne waba tanyambye.
MJAP also supported the establishment of 123 village savings and loans associations, benefiting more than 3,690 households. The groups supported members by teaching them farming and livelihood skills, enabling them become self-reliant and achieving economic independence. Beatrice, a widow and mother of 2, is a member and chairperson of Kishasha Bihare Positive Twekunde Group. She is thankful that her family has escaped poverty and despair and now has a bright future. She shares her hope with others and gives back by sharing her skills in vegetable and mushroom growing.
And we are very proud to have worked for many years with the Makerere University Joint AIDS program. MJAP has worked with some very large population centers, both here in Kampala as well as in Mbarara. They've been extremely comprehensive in their approach in the fight against HIV/AIDS. So what MJAP has done is they've done comprehensive prevention. They've found people infected with HIV, they've linked them to care, they've kept them on care. We know that one of the MJAP staff was recently awarded a PEPFAR Hero Award, again showing how important that partnership is and how the staff of MJAP have really excelled in their job. And for that we're very grateful, and we've been very happy with this partnership over the years.
MJAP is one of our key partners in the national HIV response through their provision of comprehensive services in the different programs and projects that they provide. And as Uganda AIDS Commission, we are proud of MJAP's contribution to the national response. We've instituted what is known as the HIV Leadership Awards. 2 years ago, MJAP was a recipient of this Leadership Award, as a runner. And that further demonstrates, the work of MJAP, what they have been able to do. We look forward, to MJAP continuing with this best practice, delivering services in the way that they have done. We will continue to partner with them.
Looking back, the journey so far has been an array of programs and interventions, all geared towards ending AIDS by 2030. Despite the significant gains and obvious strides taken to that effect, it is not yet uhuru. HIV prevalence, which had gone as low as 6.5% in 2014, seems to have now stagnated at 7.3%.
There's still a lot that must happen in order to see the end. But we would have moved a great distance towards the end of the AIDS epidemic. That is, if this country continues with sustained efforts by putting resources into the fight against the epidemic, there's no reason why we should not move much closer towards the elimination of the epidemic.
We're very committed to this fight against HIV, and we want to see it through to the end. And fortunately, with the help of this program, MJAP, we think we're very close to doing that.
As part of the wider global movement fighting HIV/AIDS, MJAP is proud to have worked on this project. These achievements have reinvigorated our vision of universal and equitable access to quality health care for healthier populations and reassured us that one day we shall indeed herald an AIDS-free generation.